To another Facebook Live session. If you didn't get my topic today, it's everyone says I have a neck swelling. And the reason I did this topic is because it's quite a common thing that I see in the clinic. People come in and they tell me, Doctor, I think my neck is swollen. Doctor, I think I have a thyroid problem. So, what I'm going to go through with you is just our approach and what the possibilities are in terms of actually, what the diagnosis could possibly be. So, we're going to share the slides. Okay, so the topic here is everyone says my neck is swollen. Do I have a thyroid problem? Now, often when patients have neck swelling, when you have something like this, a big neck swelling, usually it's not a problem. Everybody notices it, and patients come to hospital as soon as they notice something this big. Or here, this lymph node is swollen, and the patient again, the patient would come to hospital because she feels that there is definitely something wrong. The problem is this: when you have something smaller, that's barely noticeable, patients do not notice until someone says, "Hey, I think your neck is swollen. Maybe you should go and see a doctor." Then they start panicking. So, a lot of times, when you have a neck swelling that is smaller, people notice it. You may not even notice it. You look at your neck every day and you realize that, oh, it may not be there because it just seems normal to you. Now, what is the neck swelling? Basically, if you look at this anatomical structure, it's quite complicated. In the neck, there are so many different structures. The thyroid sits here, this white thing here, there's blood vessels, there's all these white things here are lymph nodes. Kelenjar getah bening, or if you want to call it kanhat or whatever it is, but they are lymph nodes. And so there are a lot of structures, muscle, etc. So a lot of times we have to figure out what the cause of the swelling is. It may be the thyroid, and commonly it's due to the thyroid, but it also can be due to other things, lymph nodes, muscles, cysts from various things. So really, we need to investigate. Now, sometimes, and more often than not, these swellings are benign, and at other times they may be cancerous. So the main thing is when you see a neck swelling, you don't panic. You go and see a doctor, and the doctor will often refer you to a hospital, or if you come to hospital, maybe you see me or a surgeon or whoever. And the thing is that whatever it is, as soon as you realize that there is something wrong, you need to seek medical attention. The important thing is that we come to a quick and early diagnosis so that we can get treatment started. Let me give you an example. I saw this lady a couple of years ago. She's 38 years old. I still see her. And she had a right sided neck swelling for about 8 months. She thought there was something there. She felt that, when she put a hand on her neck, she felt that it was not right. So initially she ignored it, as is most common how humans do that. Then she got worried because every time somebody kept pointing out that there was something wrong with her neck. So, and then she noted that it was increasing in size. So when people start pointing it out, then she started to worry that, hey, maybe there's something serious going on. Now, in medicine, we talk about red flags. So a red flag basically means that it's when is it a problem. So what is a red flag? Well, if you're a male, if you're very old or very young, if you have something that's growing very rapidly, that means, one month it was small, and then the next couple of months you feel it, they say, wow, it's grown so much. If you have symptoms of local invasion, that means you have something in the neck, but other structures may be affected. That means you've got hoarseness of voice, your voice sounds like chaw chaw like that. And then, sometimes you have difficulty in swallowing, there is pain when you touch the area. These are not so good signs. If you had a history of radiation as a child, some people have had radiotherapy for something or other, then it can be a problem. And if you have a family history of cancer, particularly thyroid cancer, this is something that we need to be aware of. So if you have these red flags, then you should be more concerned and really should seek medical attention. So I look at this lady and she's very fit. There's not really much of a much on examination, and I noticed that there is this swelling here, it's 2 centimeters or more. There's no signs of hyperthyroidism overactivity, and otherwise she's normal. There's no lymph nodes that I could feel. So the question then is, what's wrong with her? And this is a question everybody wants to know. Now, there's many reasons why someone can get a neck swelling. It could be infection. It could be an abscess. It could be TB. It could be, we see TB quite often in this area. You get TB lymph nodes, tuberculosis. It could be cancerous. It could be, swelling of your parotid gland. It could be cysts. It could be other things. So basically, you are scared after you realize that there's something there. Then you start searching on the internet, and this will scare you even more. I mean, going on Google and other search engines to look for causes of swelling will eventually lead you to cancer. So you get scared unnecessarily. So the most important thing is you need to consult your doctor, because we need to do some tests to try and find out what exactly the problem is. So when I examined this lady, based on the position of the swelling and the fact that it moves with swallowing, when something is thyroid related, when you swallow, the lump will move up and down, and this is because of the nature of the thyroid, which actually moves up and down when you swallow. So it is safe to assume that I think that this is the thyroid gland which is involved, and I proceeded to do what I would normally do, investigations, etc. So what do we do next? So when you visit a doctor, basically we've examined you, we've taken a history, then we should have to do some basic investigations. So we order blood tests. So what I would do, if someone presents to me with a neck swelling like that, I would make sure that they are not having any infection. So I would do a blood count, I would check hemoglobin, white cell count, and so on. I would also look for evidence of TB, and I would do a thyroid function. So this would give me an idea if there's any overactivity of the thyroid, because sometimes when patients have an overactive thyroid, the thyroid can also be enlarged. So the initial assessment of a thyroid swelling, say, look at this lady here. This lady has lymph nodes. So these are lymph nodes that are enlarged. And she actually had, this was an old case of mine many, many, many years ago. And this lady actually had thyroid cancer. So you can see the CT scan and all that. So most of the time, when we do an initial assessment of the neck, an ultrasound of the neck is actually very useful. So we don't really need a CT scan, maybe later, once we get an idea of what the ultrasound shows, because the ultrasound can give us a lot of information as to what it possibly could be, whether it's a cyst, whether it's a, whether it looks like a tumor, whether it's a single cyst or a nodule, Bartley, Chewy, whatever. These are the things that we look for on an ultrasound. So the ultrasound is very useful. I can do it in my clinic. We can also send you off to the radiology department. The X-ray doctor, radiologist can actually do it, and the pattern of the ultrasound actually guides you as to what to do next. So if there is something in the thyroid, we can use these ultrasound features and the ultrasound findings to actually guide us as to whether we need a biopsy or not. So an ultrasound. So ultrasound results in this lady showed that she actually had a thyroid nodule. And the good thing about an ultrasound is that it actually allows you to tell whether the patient has what we call a suspicious looking nodule or not. So in a suspicious looking nodule, there are features that the radiologist will see, and they say that, oh, I'm worried about this particular nodule that this patient has. If the thyroid is grossly enlarged, that means the whole thyroid is enlarged, then there will be different features that the radiologist will point out. If it's a solitary small little nodule, then this is what they will find or they will report. So these are examples of nodule. This is the whole thyroid, and you can see that there is something here. So this is a Bartley or a solid nodule, and these areas of thing black here are liquid. Here, this is a thyroid cyst where I see liquid. This is water or a colloid cyst, and the other areas are actually the solid within that whole nodule. Here you can see the nodule. So this is what the ultrasound shows us, and it actually gives us an idea of where to go or what to do next. Sometimes when patients have like a very large swelling, if there's evidence that, oh, maybe they're having breathing difficulties and so on, a CT scan will be a useful thing. So here you see this is a huge thyroid scan, and this is the clavicle, the bone here. This is your clavicle, and this thyroid has actually gone below that. So this is a large thyroid scan, and the features that patient would have would be difficulty in swallowing and even breathing, sometimes breathing difficulties, because the thyroid is basically choking the patient, and this needs to be removed by operation. So the next step after you do the ultrasound or the CT will be deciding whether what you need to do, whether you need to go for surgery, whether you need to go for a biopsy and all that. This will be determined by what the ultrasound shows us. So if like that patient I was giving you an example of, she had a nodule and the nodule looks suspicious, then the first initial evaluation could be a biopsy, or if the patient prefers, the patient could actually go for surgery. So this is the biopsy, and this is a fine needle aspiration that we do in the clinic. This is a gun which is attached to a syringe, and you can see that there's a needle there going into the patient. So basically, the syringe here is actually is put on this gun, and the reason we use this gun is because it allows us to get a proper vacuum when we're doing this procedure. I've done many biopsies in the clinic. This is a very simple, straightforward procedure, painless almost. So far, I haven't had anybody run out screaming of my clinic. So it's a very useful way of actually getting a sample of tissue to determine whether there is a problem or not. So this may come back as this is a thyroid cancer here, but it may also come back as an abscess with some pus. It may be TB. It could come back as just fluid, whatever it is. That will actually then allow us to take it to the next step. Now, these biopsies, I often hear questions like, "Oh, patient doctor, I don't want to do the biopsy because I'm scared. If I put the needle in and I take a biopsy, the tumor will spread more rapidly." In some cancers, this is the true case where if you put a needle in, you have to be very careful about seeding the tumor elsewhere. But for thyroid and other neck lesions, usually the first treatment or the first option is actually to do a biopsy with this fine needle. The needle is very, very fine. It's the needle that we use to take blood, and this will guide us. So, a fine needle aspiration biopsy. This patient had TB, lymphadenitis. So what you're seeing here is actually they're pulling out pus from the TB lymph node. So again, a very useful way of trying to make a diagnosis. So this is another cause of neck swelling where the patient has a TB lymph node, TB which is only exclusively in the lymph node, and the pus there will be sent to the lab, and this will give us a diagnosis as to what it possibly could be. So this patient now has thyroid cancer and she agrees for surgery. So the choice of surgery really is determined by what we think the patient has. You can see here is that the patient actually, this is my colleague's drawing, had the tumor is here, and then there's few lymph nodes, etc. And he's put their lymph nodes are actually removed during surgery. So this lady underwent a total removal of her thyroid and subsequently was confirmed to have thyroid cancer. So the best surgical option really will determine on what we find. If we think that there is a malignancy or a cancer, then really we need to find an experienced surgeon and make sure that they remove the whole thyroid. And we need to find a surgeon who does more than 25 of these operations per year. So your operation could be a lobectomy, which is half. It could be a subtotal thyroidectomy. They leave some behind, or a total removal of the thyroid. We prefer total removal when we're worried about cancer. If the cancer is very small and localized to one side of the thyroid only here, then we can actually just do a hemithyroidectomy or a lobectomy. That means half the thyroid is removed. So the patient doesn't have to take hormone replacement for life. So what next? So after the patient has had thyroid cancer diagnosis and all that, we need to send her for treatment. So again, now treatment will be very much determined by what the cause of the neck swelling is. So let's say you find on an ultrasound that the patient has an abscess, one of the lymph nodes has an abscess or pus inside, then the treatment is antibiotics. If it is TB, then the patient will need 6 to 9 months of TB treatment. If it's a thyroid lesion, then most of the time, if you're worried, then you either do an aspiration like I did and take out the fluid if it's a cyst, or in some cases, patients will require surgery as I described. If it's a cancerous kind of lesion, sometimes we need to give radiation and chemotherapy. If it's lymphoma, for example, cancer of the lymph nodes in the neck and the chest and elsewhere, then the first choice of treatment is chemotherapy. Sometimes we do nothing. If the patient has a small little cyst that is a chewy liu, it looks very benign on an ultrasound. Sometimes we do nothing. And if the patient has thyroid cancer after surgery, we give them radioactive iodine. So it's very difficult for me to give you specifics. It really depends on what the patient has. So what I've tried to show you is basically when you have a neck swelling, it has to be looked at very carefully and then go through the steps which I have described for you. So in conclusion, the causes of neck swelling are very, very variable. Okay, it could be anything. So basically, it could be the thyroid, and commonly it is the thyroid swelling. Thyroid swellings can occur at any age. It can occur at puberty. It can occur even in the older age groups, etc. So we need to examine this. The important thing, the message I'm trying to get to you is that when you have a neck swelling, don't ignore it. It may not go away. You need to seek medical attention and get a proper assessment as soon as possible. Thank you very much. I'll be happy to take questions if there are any. Okay, hang on. We're trying to find the questions. Just while waiting for the questions, next Ramadan is coming up soon, and basically what's going to happen is I'm going to do a talk about how to prepare for Ramadan if you're diabetic. We'll do this in the next couple of weeks, so look out for it. I'll do that in Malay. So basically, it is preparing someone who has diabetes for Ramadan. What you need to do, what the steps are. So here, doktor kalau sakit sikit je bengkak tu, kena datang juga ke kalau tak sakit? Now, biasanya soalan anda tu memang menarik. So, kalau tak sakit, ada bengkak, tak perlu pergi ke hospital ke tak? Now, kebanyakan condition atau masalah yang menyebabkan pembengkakan di leher itu tidak sakit. Thyroid cancer tidak sakit. Kalau thyroid itu terlalu aktif juga tidak sakit. Kadang-kadang kalau ada pembengkakan di kelenjar ataupun di limpa ataupun di lymph nodes itu pun tidak sakit. So banyak condition yang saya ceritakan tadi tidak sakit. Jadi ya nasihatnya harus pergi cek di doktor untuk pastikan tidak ada masalah besar. I have a friend who has a thyroid and her neck shows something like a granule. Is it necessary to have a a CT scan or do a biopsy? Okay, so basically, what I assume is that the patient had a swelling and she was seen by a doctor and the doctor did a scan. So is it necessary to do a CT scan first? In most cases, if you ask me, I would do an ultrasound first, and then an ultrasound there would guide if there's any abnormal areas in the scan where you need to biopsy. Sometimes a CT scan may show a swelling or a tumor, but sometimes if there's inflammation, it may not show up so well on a CT scan. So most of the time, the first step is get an ultrasound, and then afterwards, if necessary, a CT scan, and then decide whether a biopsy is necessary. But if there's something there, something looks abnormal, the radiologist will be able to grade the findings on the ultrasound and tell you whether it's suspicious or not suspicious of a cancer or something else. Then you decide whether you want to do a biopsy. Does emotion and stress affect the thyroid? Okay, this is a question that I get very, very, very often. So, what happens is the patient comes with hyperthyroidism, or the thyroid hormone levels are very high, and then they say, Doctor, I'm under a lot of stress. And I think this is what caused the thyroid to become overactive. In actual fact, it does not. Emotion probably does not affect the thyroid. However, a high thyroid level can make you more emotional. So it's like a chicken and an egg glass. So if you have a lot of stress, it looks like you have thyroid problems, but you actually not, maybe not thyroid problems when you check your bloods. But if you have a thyroid condition like hyperthyroidism, that means your thyroid is overactive, Your symptoms, what you experience is emotion, a fast heartbeat, you easily get angry. So this is like also like stress effects. So that is actually one of the gejala, one of the symptoms of thyroid disease. Okay, saya ada penyakit hyperthyroid dan leher saya ada mengalami bengkak. Bolehkah bengkak ni hilang dengan makan ubat yang doktor di klinik bagi? Dan saya seorang yang minat bersenam, tak apa-apa kalau saya bersenam. Okey, soalan pertama. Jika anda mempunyai hyperthyroidism, biasanya penyebab utama penyakit ini adalah penyakit thyroid autoimmune yang dipanggil Graves disease, Graves. Graves disease ini boleh menyebabkan pembengkakan di leher. Pembengkakan di leher. So kalau ada pembengkakan itu, biasanya dia akan mengecil sewaktu ubat diberi dan ubat anti thyroid yang diberi oleh doktor anda. Tetapi kadang-kadang bengkak itu tidak akan hilang, semua hilang lah. Dia masih ada, mungkin ada sisa sedikit ke, boleh nampak lagi. So kalau seseorang yang mempunyai thyroid yang besar dan mereka rasa tidak cantik atau apa, atau mereka fikirkan bahawa oh tidak cantik kalau dilihat, dan kadang-kadang pasien pergi untuk operation atau radioactive iodine yang akan mengecilkan thyroid itu. Saya seorang yang minat bersenam. Kalau thyroid itu tidak terlalu aktif, hyperthyroid, dan sudah terkawal dengan ubat yang dimakan tu, then anda boleh bersenam tetapi mengikut keupayaan diri sendiri. Jangan anda punya heart rate itu memang dari awal sudah 100, jangan pergi olahraga nanti dia makin cepat, itu mungkin membawa mudarat. So kalau seorang itu sudah terkawal dengan ubat, kita boleh katakan anda boleh olahraga, bersenam dan sebagainya, takat kemampuan anda. Okey, so anda boleh bersenam. Makanan apa yang saya perlu untuk mengelakkan? Okey, biasanya kalau seseorang itu ada penyakit hyperthyroidism, kita tidak khususnya mengatakan bahawa anda tak boleh makan makanan yang seperti sayur, atau biasa yang ditanya tu seaweed lah, seaweed, and then setengah orang suka kobis dengan brokoli dan sebagainya. So biasanya kobis, brokoli dan sayur seperti itu mengandungi sesuatu yang dipanggil goitrogen. Goitrogen itu adalah sesuatu bahan kimia yang boleh menyebabkan thyroid itu membengkak. Tetapi jika anda mempunyai hyperthyroidism, saya rasa tidak ada apa-apa yang khusus yang anda perlu elak. Sebab kalau anda makan sushi atau satu keping seaweed itu, dia punya konten iodin kecil. So saya rasa anda tidak perlulah mengelak daripada makanan yang khusus. Okay? So anda boleh makan semua sayur lah. Saya kerap sakit dada, panic attack, menggigil, suka tidur, gelisah, badan saya panas tetapi suhu normal. Okey, itu memang adalah gejala hyperthyroid, sebab memang gejala itu ada debaran jantung, detak jantung itu terlalu cepat dan sebagainya. So gejala yang ditulis itu dalam soalan ini memang adalah gejala hyperthyroidism. Tetapi apa yang anda perlu faham adalah hyperthyroidism ini kadang-kadang bila anda mempunyai masalah psikiatrik atau masalah pemikiran atau terlalu panik, itu juga seperti orang yang punya penyakit hyperthyroid. So kadang-kadang pasien yang mempunyai gejala seperti ini akan pergi ke ahli psikiatri, mungkin dia datang ke saya, mungkin dia pergi ke doktor jantung. So cara yang paling uh, tepat untuk tahu sama ada seseorang itu punya penyakit thyroid atau tidak adalah dengan pemeriksaan darah. So ya betul, simptom itu simptom hyperthyroid. So untuk pastikan 100% sama ada masalah atau tidak, anda perlu pergi periksa darah di lab. The swelling in my neck is not that big and I have no pain. As I said before, some swellings, usually thyroid swellings are not painful unless there is inflammation or there is an infection there. Would it become smaller? So it may become smaller if it's a cyst or something, but what should you do is basically what I have described in the talk. go and see a doctor who will probably ask you to get an ultrasound done, and then you proceed from there. If there is a thyroid swelling, or if it's a lymph node swelling, or it's something else, then basically it depends on what the doctor finds on the ultrasound that will guide the next step. But basically, this should not be ignored because you have recognized that there is a neck swelling. So the next step should be you get medical attention. Okay, so that's the end. I think that was the last question. So in 2 weeks' time, we'll do a Ramadan talk, as I already said to you. We're going to try and help you manage your diabetes during Ramadan, whether you're on insulin, whether you're on tablets, and basically talk a little bit about who should fast, who shouldn't fast, who can fast, and the types of medications that can be used during Ramadan. So I hope to see you all in 2 weeks. Thank you very much.